I can give a few examples of how I've used Oncotype Dx in helping patients make decisions. And again, that decision is a joint decision between me as their doctor, who's taking care of the prostate cancer, and them as the patient. So in one example, there is what we call downgrading, which means you start out with a certain type of prostate cancer, call it intermediately aggressive. And then when you run a test like Oncotype Dx, which tells you the true biological potential of that cancer, and the test says, you know what, this is actually a non-aggressive cancer. It's something that's less aggressive than what the biopsy is suggesting. That's called downgrading. And so I've had several patients where they come in wanting treatment because they're scared and they're concerned that they have prostate cancer. We run the Oncotype Dx test, and it shows that their cancer is actually not as aggressive as many other prostate cancers, and in that situation, those men have decided not to undergo immediate therapy, and we're doing active surveillance. And so we're watching it with a close eye, and you run several tests along the way to make sure it doesn't change. On the other hand, there are some patients who have, and this is a less common scenario, but there are some men who have what we think is a very non-aggressive prostate cancer. I've run the Oncotype Dx test, and it suggests that it perhaps is a biologically more aggressive cancer. And in that instance, we call that upgrading, and we do choose therapy in those situations. So there are lots of times where the Oncotype Dx test will actually help make the decision as to whether you should treat, at least immediately, or you could consider active surveillance or watching it for the time being as a viable option.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.